My name is Right Honorable Kwamati Beatrice Lowry, and I speak for the people of Jamsandum and Lamode Federal Constituency of Adamawa State. I brought this motion as a matter of urgent public importance outbreak because it has to do with droplets and its respiratory. It affected the nose, the throat, the and extreme cases the heart, and of course it causes death. And we know it is part of the government policy, to give free immunization in respect of this. But then, why are we having this? Obviously, there is some gap somewhere. Either some people are not doing their job, or either the vaccine are not being provided, or those health workers are not doing their job by vaccinating people. And we cannot be losing lives for diseases that are avoidable, that are even eradicated in some climes. Why here? If you look at even a lesser country, just like Gabon, like Mauritania, like Niger, they give massive vaccination. They have cases of outbreak, but just with minimal fatalities, but not like in Nigeria. You can imagine the kind of number of deaths that we are harvesting because of this. It's really frightening. Thousands of people dying because of something that is avoidable. It is time for the government to rise up to its responsibility and save the lives of its citizens. Most of these days are young are children below the ages of 14. And children, they like to play, they like to mingle together, and that is how it spreads so fast among children. And it is time, we protect this generation so that we can have a better future. Some of these lives that we have lost may have been one of the brightest that we may have in this country, but they are gone. And every government, every responsible government have to rise up to ensure that the welfare of its citizens is a priority. And that is why I moved to say that, look, let's move immediately for the government to cope up this. If not, the spread is fast. Because if you have it and you move to an area, you are going with it, and before you know it, it will spread in that place. And of course, you cannot stop the movement of people. Nigerians are so fluid; they can move here and there. And of course, it is an infection that is mostly in a crowded environment. Where we have slums and where we have high density population, the outbreak is very fast in there because, it's a crowded place. So we need to move very fast and make this immunization taken to every nook and cranny of this country. That's why I insisted that the 774 local governments, there should be reports on this, and let us know exactly what is happening in each of the local government in the federation in respect of immunization on the case of diphtheria. I know as a fact that I think the immunization of a recent has been combined with that of measles, so that you'll be given at once. You have diphtheria and measles given at once. Yes, but then are we having statistics? Are we reaching out to people? With the advent of so many health centers now, private clinics being open, what is the monitoring rate about those areas, those that are going to those places? Are they also captured by the government? That is an information we don't have, because it's paramount we have this and make it available, vaccine available in those areas so that people can have it. And we have to ensure that, since government is paying and it's free, we have to ensure that those health facilities that are private, have them, and we have to take statistics, and we have to have, records and data of those people that are taking it. It is in that way that we can easily, minimize or completely eradicate this diphtheria. At this age and time, I don't think we should be having issue of deaths in respect of this. Yes, that is why we mandate them now to provide us with information and records, and that is how we will know what they are doing, whether they are really performing to optimum. Because if they are performing to optimally, we shouldn't be having these cases, and we shouldn't be having it in that number with the fatalities. Fatalities is so alarming. So I don't think it's a difficult thing, because if government is providing enough vaccine for people, then we should not be having this kind of outbreak that is so outrageous. Of course, all these government departments must go out and do their works, and they have to provide data, because government cannot spend money, government cannot expend so much resources, and then we are not seeing results and we are seeing negativity. Then that definitely something is wrong somewhere. But by the time we are availed with this data, we will know where to put the blame squarely on, and who is not doing his work. And it is in that respect that we now know, okay, this is where we are handicapped, this is where we are having some gaps. Then that gaps have to be filled, so that we don't find ourselves in this kind of situation we are in, that at this point in time we are having uh, this kind of rate of deaths. It's so alarming.
Okay, one would have thought too that besides treatment, testing, and all of that, that the essence awareness will be very key.
That is why even in
And I
the
didn't see anywhere you're
even in the
taking.
motion on the second one, we have directed that Federal Ministry of Information and National Orientation should raise public awareness through sensitization, because it's very, very important. And that is the duty of the National Orientation and Ministry of Information. They are saddled with that responsibility of raising awareness. It is their duty, because there has to be jingles, there has to be posters, there has to be radio news and announcements in respect of this, so that people will hear. Virtually now, at least we are having a global world where at least technology is moving very fast. The social medias are there. They have to leverage on it and send messages. The radio is there. Every poor man at least can listen to a radio. Not everybody has a television to watch and see this. But the radio is there and the telephones are there. Even the network providers can be used to disseminate this information. You know, they can make it as caller tunes and be passing this information. They can make it as messages and be sending to people. That way, raise awareness. Nobody want to have his child dead. And by the time you show people the implication, if they don't, definitely everybody will rush to have his children, take this vaccine, because it's mostly is the children. Only few adults who have immune deficiency that it can affect. So we need to tax those that are responsible to raise this awareness. And we have asked that the Ministry of Information and National Orientation should take up this. The most states affected by this is the states are Borno, Bauchi, Jigawa, Kaduna, Katsina, Kano, and Yobe. These are the states that are most hit. Not that the other states don't have, but these are the states that are most hit, that have highest record of this outbreak. And the resultant date is that we have over 1,279 deaths out of the over 30,000, 34,000 reported cases. We are having 1,279 deaths, which is quite alarming. Given the ratio of the reports and the number of deaths, is something that need to be done urgently.